Amenorrhea is the absence of menstruation. It affects women of all ages. It's important to understand that missing your period occasionally is normal. However, missing it for several months in a row can indicate an underlying health issue. Amenorrhea can be broadly categorized into two types, primary and secondary. Primary amenorrhea is diagnosed when a young woman hasn't had her first period by the age of 16. This could be due to a variety of factors, ranging from genetic conditions to lifestyle choices. Early detection and intervention are crucial for managing primary amenorrhea and its potential long-term effects. Secondary amenorrhea, on the other hand, occurs when a woman who has previously had regular periods stops menstruating for 3 or more consecutive cycles. This type of amenorrhea is often linked to lifestyle factors, hormonal imbalances, or underlying medical conditions. Addressing these underlying causes is key to managing secondary amenorrhea effectively. Understanding the difference between these two types is crucial for proper diagnosis and treatment. Recognizing the signs and seeking prompt medical attention can significantly impact a woman's overall health and well-being. Imagine a young woman approaching her late teens, yet she hasn't experienced her first period. This is the reality for those with primary amenorrhea. This condition can be a source of anxiety and uncertainty for both the young woman and her family. Primary amenorrhea is often a sign of an underlying medical condition that requires attention. It's not merely about the absence of a period, it's about understanding what this absence signifies for overall health and development. Several factors can contribute to primary amenorrhea. Hormonal imbalances, genetic disorders, and anatomical issues can all play a role. Sometimes, lifestyle factors like extreme dieting or intense exercise can also disrupt the delicate hormonal balance needed for menstruation. Diagnosing primary amenorrhea usually involves a combination of physical examination, medical history review, and laboratory tests. These tests help healthcare providers identify the root cause of the condition, which is crucial for determining the most effective treatment approach. Early diagnosis and treatment can prevent potential complications and ensure a young woman's healthy transition into adulthood. Secondary amenorrhea is the absence of menstruation for 3 or more consecutive cycles in women who have previously had regular periods. Unlike primary amenorrhea, which is often diagnosed in adolescence, secondary amenorrhea can affect women at various stages of their reproductive years. This condition can be a symptom of a wide range of underlying factors, some as simple as lifestyle changes and others as complex as chronic medical conditions. Stress, significant weight loss or gain, and excessive exercise are common lifestyle factors that can disrupt the menstrual cycle. Hormonal imbalances, often caused by conditions like polycystic ovary syndrome, PCOS, or thyroid disorders, are also frequent culprits behind secondary amenorrhea. In some cases, medications like antidepressants, antipsychotics, and certain chemotherapy drugs can interfere with menstruation. Diagnosing secondary amenorrhea typically involves a thorough medical history review, physical examination, and various tests to rule out pregnancy and other potential causes. Identifying and addressing the underlying cause is crucial for effective treatment and the restoration of regular menstrual cycles. Unveiling the causes primary amenorrhea. The causes of primary amenorrhea are diverse and often complex, requiring a multifaceted approach to diagnosis and treatment. Genetic conditions such as Turner syndrome can interfere with ovarian development, leading to the absence of menstruation. These conditions are often present at birth but may not be diagnosed until puberty fails to occur as expected. Anatomical abnormalities, such as an imperforate hymen or vaginal agenesis, can also prevent menstruation, even when the ovaries are functioning normally. These conditions typically require surgical intervention to correct the structural abnormality and allow for menstrual flow. Hormonal imbalances, often stemming from problems with the hypothalamus, pituitary gland, or ovaries, can disrupt the delicate hormonal cascade needed for menstruation. These imbalances can be caused by genetic predispositions, tumors, or other underlying medical conditions. Lifestyle factors, while less common in cases of primary amenorrhea, can still play a role. Extreme dieting, excessive exercise, and psychological stress can disrupt the hormonal balance needed for menstruation to occur. Delving into the causes secondary amenorrhea. Secondary amenorrhea, unlike primary amenorrhea, often stems from acquired factors that disrupt a previously normal menstrual cycle. One of the most common causes is pregnancy, a physiological state where menstruation is naturally suppressed to support the developing fetus. Breastfeeding can also lead to temporary amenorrhea due to the hormonal changes associated with lactation. This type of amenorrhea is usually temporary and resolves once breastfeeding is discontinued or reduced. Menopause, a natural biological process marking the end of a woman's reproductive years, is another common cause of secondary amenorrhea. As ovarian function declines with age, estrogen levels drop, leading to the cessation of menstruation. Certain medications, particularly hormonal contraceptives like birth control pills, patches, injections, and implants, can cause secondary amenorrhea. These medications work by suppressing ovulation, which can lead to thinner uterine lining and lighter or absent periods. Chronic medical conditions like polycystic ovary syndrome, thyroid disorders, and pituitary tumors can disrupt the delicate hormonal balance needed for menstruation. These conditions often require long-term management to regulate hormones and restore regular menstrual cycles. Recognizing the risk factors. Recognizing the risk factors for amenorrhea is crucial for early detection, timely intervention, and potentially preventing long-term complications. While some risk factors are beyond our control, understanding them empowers women to make informed decisions about their health. Family history plays a significant role, as a family history of menstrual irregularities, early menopause, or certain genetic conditions can increase a woman's likelihood of experiencing amenorrhea. Lifestyle factors such as extreme dieting, excessive exercise, and high levels of stress can disrupt the delicate hormonal balance needed for regular menstruation. These factors are often intertwined, creating a vicious cycle that can be difficult to break without professional guidance. Certain medical conditions such as polycystic ovary syndrome, thyroid disorders, and autoimmune diseases are strongly associated with menstrual irregularities, including amenorrhea. Medications, particularly hormonal contraceptives and certain psychiatric medications, can also interfere with menstruation. It's essential to discuss potential side effects with a healthcare provider before starting any new medication. Early detection and intervention are crucial for managing amenorrhea and its potential long-term consequences. By understanding the risk factors, women can be proactive about their health and seek timely medical advice if they experience any menstrual irregularities. Seeking diagnosis and treatment. If you're experiencing amenorrhea, seek guidance from a healthcare professional. They will evaluate to determine the cause of your missed periods. This includes a detailed medical history and physical examination. Tests like blood tests, pregnancy tests, and ultrasounds may be ordered. Treatment varies based on the underlying cause. Managing any identified condition often restores regular cycles. Lifestyle changes can also help regulate menstruation. Early diagnosis and treatment safeguard your health.